it can still end in violence, though, can't it, against people who are working to keep prisoners safe?
Justice has to be seen to be done, and no more so than by the victims of murderers and rapists like Lucy Letby. It has to be seen to be done.
Let us know what you think. gbviews@gbnews.com. Now, joining us next is Dr. Amanda Lee, who's a former neonatal nurse and senior lecturer in adult nursing. Good morning. You described the life of a neonatal nurse as emotionally charged, complex, but also a privilege. It's quite shocking, really, isn't it, the way in which Lucy Letby abused that privilege?
I absolutely agree. I'm absolutely abhorred by what I've read and what I've heard about Lucy Letby, about the whole trial. I'm old enough probably to remember the days of her counterpart as well, Beverly Allett. And, you know, this shocks the whole profession to a core. Nursing's about establishing trust with the community, with the public, with everybody. And I think we're all reeling from what's gone on.
What's shocking us a lot as well, Amanda, and it shouldn't, I suppose, but when you look at photographs of her, she is a picture of innocence. Everybody talked about what a sweet-natured woman she was. We even know in her home she had lots of teddy bears on her bed, all these photographs of children, making it all the more shocking for us, but much more so for the families of the babies she murdered and attacked.
I think the thing that you need to realise when you're a neonatal nurse and when you're working in those sorts of areas, you sit day after day after day at a bedside with parents and their little cherished loved ones, and you establish such relationships. What you do at home, I don't know, but what I would say is that, you know, you're trying to establish those relationships, the trust and the compassion that you have for those babies is there. And I don't understand how anything to do with home would affect anything. I don't know. Having teddies on your bed's not going to make any difference. A 33-year-old woman with teddies on her bed, I'd be wondering that's slightly different in itself. I don't know.
Part of the job, Amanda, is for a neonatal nurse will sit by the bed of the baby that's sick, looking for signs, looking for a deterioration, looking maybe for an improvement, so they can, as part of their job, is to try and get them better.
That's right, and you have to look for the smallest of cues. So I remember sitting by a bedside with a few of the babies that I've looked after, and you look for little cues like a little tiny wince, a tiny drop in blood pressure, finger splaying, different behavioural cues as well that really alert you to signs of deterioration. And in many ways, you know, you have this relationship with the consultants and the medics on the ward as well, where you can sort of say, I'm not happy with that baby. And you know that when a neonatal nurse is pretty established and knows what they're talking about, you believe those nurses and you know that they've picked up on some sort of these minor cues that's going on.
Amanda, just because it's difficult if we don't have a sort of clinical understanding of that setting and how these babies died, how is it possible, and this sounds like a naive question, but how is it possible to know that it was deliberate murder as opposed to medical negligence of just not being good at your job? What's the line there?
You're watched, your work as a team. You know, when I started neonatal nursing, I wasn't on my own for a long time. I had to do post-registration, postgraduate qualifications and courses. You've got people overseeing you all the time. And then even when I moved to becoming an advanced neonatal nurse practitioner, you know, we were working as a team. Everybody was around. Mistakes in any walk of life can be made, but you learn to identify those mistakes, work on them, and act accordingly. We all work under the Nursing and Midwifery Council. We have a code of conduct, and we have to offer that professional competence to be able to deliver the care that we want.
So how was she missed then? If she was being watched so closely and working as a team, who else dropped the ball in that environment and didn't have an eye on her?
I don't think it's for me to start looking at apportioning any blame to anybody. I can bet you bottom dollar that every single member of that nursing team and the medics and everybody will be asking exactly that question. I've got no answer.
OK.
All right, Dr. Amanda Lee, thanks for joining us, former neonatal nurse and, of course, senior lecturer